All right, Treadwell DPT back again. Another anatomy breakdown, muscle by muscle. Today we're keeping the rotator cuff train rolling and diving into the infraspinatus. Another deep shoulder stabilizer, another rehab baby. Odds are you won't find many guys targeting this one in the gym, but that doesn't mean it isn't extremely important. So yeah, let's break it down: origin, insertion, innervation, function, and of course, a few of the clinical takeaways. If you know where supraspinatus is, you could easily find infraspinatus. Supra indicating above the spine of the scapula, and if you're being intuitive, infra and infraspinatus should indicate that we're below the scapular spine. If you want to palpate it, you could follow that point of your shoulder backwards, tracing the spine of your scapula. If you drop down from there, you're on the infraspinatus, potentially deep to your traps or deltoid, depending on where you're at. Naturally, our origin is going to be the infraspinous fossa, basically that large flat surface just under the scapular spine. It travels laterally and it inserts on the middle facet of that greater tubercle of the humerus. We see it's there inserting right below that supraspinatus tendon. So right next to each other. Pretty cool. Supra, superior, infra, inferior. Our primary role is going to be external rotation of the humerus. I'll spoil this a little bit. Teres minor, which is the topic of our next video, also does external rotation primarily. So it'll be beneficial to highlight some of the functional differences we'd see between these two muscles. We look at the size of the infraspinatus and we consider it a relatively small muscle, but it's actually our biggest external rotator. We've just got infraspinatus, we've got teres minor, posterior delt. You could technically throw in supraspinatus, but all in all, not a ton to choose from if you're looking for external rotators of the shoulder. A lot of times we'll have patients in for shoulder rehab, and of course they're doing their ER/IR exercises, and they'll say, wow, internal rotation is just so much easier for me. And it should be. There's a huge disparity size-wise, strength-wise, just the pure mass of our internal rotators compared to our external rotators. We're comparing the strength of infraspinatus and teres minor to big boys like pec major and lat dorsi, so a lot more mass for our internal rotation group. So yeah, interesting tidbit, but just makes sense if you're looking at everything. The external rotators produce the lowest maximal effort torque of any muscle group of the shoulder. Back to infraspinatus specifically, it is our primary external rotator. There are studies that say it provides about 75% of our external rotation force generally. It's the most active and strongest when our shoulder is adducted or when our arm is at our side. So 0 degrees of abduction is where it's the most active. As we increase in our abduction, that's when we see more activation of teres minor and the posterior deltoid when we're trying to externally rotate. Also, interestingly, the infraspinatus plays a slight role in abduction as well. So as we see abduction go up, we see less external rotation force from that infraspinatus, but it also plays a slight role in abduction. Of course, it being a rotator cuff muscle will also help stabilize that glenohumeral joint by compressing the humeral head into the glenoid. Big player in that force couple, maybe the biggest to be totally fair. We've got that constant balancing act, helping to counter that natural pull of the deltoid and prevent excessive superior migration of that humeral head during those shoulder movements. So very important, very important. The suprascapular nerve is our primary innervation here. Just like in supraspinatus, the nerve roots are going to be C5, C6, and occasionally C4. Same spiel, the nerve comes through that suprascapular notch under the superior transverse scapular ligament, a spot that can be compressed depending on the local situation, especially in overhead athletes or people with poor scapular mechanics. But just to reiterate, primary innervation, suprascapular nerve, C5, C6. Infraspinatus weakness shows up a lot in the clinic, especially in folks with that rounded shoulder presentation or shoulder pain, or again, just if they have that poor abnormal scapular mobility. Of course, infraspinatus originates on that scapula, so it's pretty much at the mercy of those scapular movements. We know infraspinatus is our muscle most responsible for external rotation at that 0 degrees abduction position, so when our arm is by our side. So we can get a pretty good test of its strength and function from that position. So if you want to test someone's infraspinatus strength or just function, make sure it's intact, that's the position. Arm by the side, externally rotating away from the body. When you really sit and think about it, there just aren't a ton of functional movements that involve much external rotation work. So it's not abnormal to see these muscles just sort of naturally undertrained in the general population. Isolated infraspinatus tears or injuries are really rare in comparison to suprascapular tears and other shoulder pathology. And partially for that reason, infraspinatus gets a lot of work and attention during the shoulder rehab process. A great go-to for strengthening would be that side lying external rotation with a dumbbell or potentially a band. It gets high EMG activity and minimal compensation. There's good research showing better EMG activity with the side lying wiper exercise, which is a little bit tougher and a little bit less stability, but definitely would work that infraspinatus. We're doing a lot of these type of exercises. We're doing isos, T-band stuff, anything we can to strengthen those internal rotation and external rotation muscles in the early shoulder rehab phase. Infraspinatus external rotation exercises are definitely our bread and butter in shoulder rehab. That's the go-to. You want to do a lot of that ER/IR for your shoulder patients. Always thinking about that force couple we mentioned earlier. Short rotator cuff muscles pulling down, deltoid pulling up. Got to keep that balance to avoid impingement and pain. And the infraspinatus is a huge player in that regard. So yeah, that'll do it. Infraspinatus. He's big, but he's small. Big time external rotator, major stabilizer, and a key factor in keeping our shoulder nice and healthy. If you're working with athletes, you've got post-op shoulders, maybe you're dealing with some shoulder pain of your own, gotta know this one. Gotta make sure we know our infraspinatus. Next up, we're gonna hit the teres minor, finish up that posterior rotator cuff. Then we're gonna jump over to the subscapularis and wrap the whole thing up. Hit the subscribe if you're new. More to come and more to learn. Treadwell DPT, another one. Catch you later.